and I had a procedure done when my youngest daughter was 5 months old, and I was prescribed Percocets at that point. I took that first one. All this stress and weight just fell off. I felt like it fixed me. This is amazing. This is like what I used to feel like, is how it felt. And I didn't think of that as a problem at the time. I went back to work and we only had IV fentanyl and Dilaudid. There were 3 nurses at this particular facility. We kept it in this back cabinet. I was responsible for moving IV medications from that cabinet, and I would move them to our daily stock, which is like a basket. I look at this back stock and I'm like, if I open one of these boxes back here and I take a vial, just such a small amount, because I was scared. I'm like, what if I overdose myself? And the beauty was that I knew how much it was, and I knew how to do IVs. I made the choice to put one in my purse. I remember just like that back and forth that I had that entire day at work. I waited till my family was sleeping, and I drew up like a really small amount, and I did it. It was an experiment to me every single time. It wasn't a problem. It was just a little mistake that I can fix. And it felt like the Percocet, but it was immediate. And I kept doing it. I would take from that backstock area, bring them home. And I thought that I was going to quit every single time I did it. I would say, like, this is the last time, like, never again. I'm not addicted. I got really sloppy with my charting to cover up for my theft. And so, yeah, I was caught due to forging a legal document, a doctor's document, to make up for my theft. So they wouldn't open the boxes to make sure that they were full. And I would cut a hole into the side. So there was a plastic wrap over the box, take a vial out, and that box would be missing, 5 vials. And then I would forge documentation, say that a patient was in pain when they weren't. I would just chart, because I was also the recovery nurse, and I would chart that a patient needed a pain medication when they didn't. I would take it from that daily stock and I would slowly replace them. So the week that I was fired and I forged that document, I had a wedding to go to. I was going to be in my friend's wedding, and we were going to Cabo. So the week prior, there was 1 box of Dilaudid left in that back stock. It was missing half of those vials. I thought that I was going to be gone the whole next week. I start panicking like real bad. I need to figure out a way to cover up for these and forge documentation. They found the original document, put it in the trash. The original one